Hi everyone, I am Shoba Jayakumar, one of the clinical nursing education expert. Today, I am going to give a presentation regarding coronavirus disease 2019 that is called COVID-19. Let us see some of the information regarding the coronavirus. What is coronavirus? What are the other names are there? What are the signs and symptoms will be present? And what kind of preventive measures we have to take, and what are the prognoses are associated with that? What are the preventive measures we can take for the healthcare workers? All those informations we are going to see from this video. All right. Okay. What is coronavirus? Coronavirus disease is an infectious disease caused by severe acute respiratory distress syndrome, that is coronavirus 2, SARS-CoV-2, a newly discovered coronavirus. This virus was first identified in 2019 in Wuhan, central China, and has since spread globally, resulting in 2019 to 2020 coronavirus. WHO has been declared as pandemic, as it is public health emergency of the international concern. As of 20th March 2020, the rate of death per number of diagnosed cases is 4.1 percentage. However, it ranges from 0.2 to 15 percentage depending on the age and other health problems. All right. Now, what are the other names are given to the coronavirus? Let us see about it. So there are many names. There are many names has been given for this coronavirus. One is called nCoV, acute respiratory diseases. Then novel coronavirus pneumonia, Wuhan coronavirus, and other names as SARS-CoV-2. So these are the certain names given to this coronavirus. As you know, everyone, it is pandemic. It is spread all over the country. Now, how it is outbreaks to pandemic? How it is divided into phases by WHO. So all this we will see a detail in this slide. All right. World Health Organization has been given six phases, explained this coronavirus stages as six phases of outbreak status. Since it is moved to pandemic level, phase 6 with the SARS outbreak to pandemic. So there are six phases. The first phase is a virus circulate among animals, but but with no cases reported of infection in humans is known as phase 1. Phase 2 is an animal flu virus known to have infection in humans. So this stage is considered as potential pandemic threat. That phase is called phase 2. Then phase 3 is an animal or human animal flu which caused sporadic cases or outbreak in humans but not resulted in human to human transmission, or that is sufficient to sustain the community level outbreak. So that phase is called phase 3. Phase 4 means human to human transmission of an animal or human animal flu virus that is able to cause community level outbreaks. So this here significant increases in the risk of pandemic. Here this phase contains the spread of virus all over the country. So people has to advise ban travel. Okay, so let us see this phase 5. Phase 5 means human to human spread of the viruses into at least 2 countries in one region. That is called phase 5. Phase 6 is a pandemic phase with human to human spread. Human to human spread of viruses at least 2 countries at the same geographical region it will be affected, and it is extending to at least one other country outside the region. So in this phase implementation of contingency plans for the healthcare systems at all levels needed. All right. Now let us see the common symptoms of coronavirus. So common symptoms, if you see high grade fever will be there, cough, dry cough, shortness of breath, breathing difficulties. These are common symptoms. Other symptoms include shortness of breath. Some people will be having aches, muscle aches, pain, sore throat, and very few people will be reported as diarrhea, nausea, running nose. So will be there. All right. What are the emergency warning signs and be evidence for COVID-19 virus? The first one is trouble breathing. People will be having trouble breathing. Then pain, persistent pain on the pressure in the chest will be noticed. Then patient will be confused or inability to arouse. Why this is happening? Because of low oxygen capacity in the brain tissues leads to confusion. And blue is discoloration and blue is leaf on the face. This is also one of the reason for low oxygen circulating in the tissues. So these are emergency warning signs. The patient people who reach in these conditions, they need to seek emergency life-saving support immediately. All right. Now let us see the groups which is higher risk for this COVID virus affecting. Of course, older adults are the first one, and people who have serious underlying medical conditions are the highest risk for this highest risk, and they will have more serious complications from COVID-19 virus. People who suffer with human immunodeficiency virus, then all respiratory tract diseases, then chronic obstructive lung diseases, asthma, and lung diseases, those people are highest risk people. Then people who have serious underlying medical conditions like heart diseases, diabetic diseases, cancer conditions. So these people will be having low immunity. Those people who have low immunity, all people will be affected from this COVID virus once they are exposed with COVID-19 virus. All right. How the virus is getting transmission from one place to another place or one person to another person? It's, of course, it is droplet infection, droplet of saliva and discharges from the nose. Then when an infected person coughs or sneezes, and touching contaminated surfaces and then touching to one's face, eyes, this all leads to infection. Then time from exposure to one of the symptoms is generally between 2 to 14 days, within an average of 5 days. In this time, people who exposed with other people, but without no symptoms, also those people, the contaminated people will get infection. There is a possibility. All right. Let us see the diagnosis, how the COVID-19 patients are diagnosed. The first one, the swab is nasopharyngeal swab. It will be um, screening for reverse transcription polymers chain reaction test. If it is positive, it is confirmed for the COVID-19 virus. And of course, diagnosed with the combination of symptoms, then immunoassay test, risk factors, chest CT scan showing features of pneumonia. These are giving the information for diagnosis. Now let us see the treatment of infection, prevention and control measures. Treatment of choice for this COVID-19 virus is the main goal of treatment is infection prevention and control measures. Supportive treatment, including supplementary oxygen and mechanical ventilatory support. Since this is an acute respiratory distress syndrome, mechanical ventilator support and supplemental oxygen is the major treatment should be given to this COVID-19 virus. Then Treatment of choice as an investigational drugs has been practiced in some of the countries like that is according to CDC recommendation. Remdesivir is an investigational intravenous drug with broad antiviral and activity that inhibits viral replication through premature termination of RNA transcription and has in vitro activity against SARS-CoV-2 and in vitro and in vivo activity against related to beta coronavirus. Another two oral prescription has been recommended by CDC, that is hydrochloroquine and chloroquine. These are the medicines are drug of choice for malaria and certain inflammatory conditions. Both the drugs have in vitro activity against the SARS-CoV-2 and other coronaviruses, with hydrochloroquine quinine having relatively higher potency against the SARS-CoV-2. All right. Now, management of healthcare workers exposed to COVID-19 virus. All doctors and nurses, all healthcare workers are uh, most people exposed with the coronavirus disease. Those people are very risky people. As for WHO recommendation for healthcare workers at a high risk for infection, is WHO is recommending stop all healthcare interactions with the patient for a period of 14 days after the last day of exposure to confirmed COVID-19 patient. Then they have to go for the test for COVID-19. They need to be quarantined for 14 days. We need to provide psychological support, provide compensation for the period of quarantine and for the duration of illness. Should be provide review for infection control training for the healthcare facility staff. This is the recommendation from WHO. Then another recommendation from WHO for healthcare workers exposed to COVID-19: self-monitor temperature and respiratory symptoms daily for 14 days after the last day of exposure to COVID-19 patients. Then reinforce contact and droplet precautions, reinforce airborne precautions, reinforce the rational, correct, and consistent use of personal protective equipment. Also, WHO is recommending all the healthcare workers to follow 5 moments of hand hygiene using the 7 steps techniques of hand hygiene. Then the practice respiratory etiquette all times. All right. How can we prevent this coronavirus outbreak? We can prevention is better than cure. As per this approach, correct hand washing technique is the first ideal one. Every healthcare workers, every people has to go to this effective hand washing technique to break down this chain. Cough etiquette, avoiding close contact with sick people, subclinical carriers, social distancing, alcohol-based rub frequently, not touching to the face, eyes, ears. These are the major preventive measures every one of us needs to take. Wash hands frequently. Throw away the used tissues in the proper place. Avoid touching your eyes. Then avoid close contact with the people who are ill. These are major concerns. Travelers from countries with the widespread of prevention is very important. They have to stay at home for 14 days. And time you left an area with widespread ongoing community spread and practice social distancing is the major for advice needed for travelers. Carry, caring for ourselves at home is very important. Staying home from work, school, and away from other public places. If someone goes out, avoid using any kind of public transportation is very important. Ride sharing or taxis should be avoided. Then exposed people, we have to monitor their symptoms very closely. If it gets worse, call for the doctors immediately, and they need to get rest. They have to need to stay at home and hydrated. How we can protect ourselves? Let us see about the prevention methods. Wash hands. When we need to wash? How to wash is very important. After coughing or sneezing, we need to wash our hands. When caring for the sick, need to wash our hands. Before, during, and after preparing food, need to wash our hands. Before eating, after toilet use, when hands are free, visibly dirty, after handling animals or animal waste, all these kind of actions, end of these actions, we need to do the hand washing. All right. How this COVID-19 virus prognosis will be? So prognosis is always, it is fatality rate is high, case fatality rate. Overall global case fatality rate is approximately 4% according to WHO on 19th March. But it is varies between countries. For example, in Italy, the country with the highest number of the cases outside the China, the case fatality rate is 8%. But the fatality rate is depends on certain factors with the disease progression and poor prognosis. In one retrospective analysis of 78 persons in Wuhan city include older age, history of smoking, maximum body temperature on admissions, respiratory failure, decreased serum albumin level, significantly elevated C-reactive protein. All these factors are associated with the prognosis. And thrombocytopenia also one of the major factors associated with increased risk of severe respiratory disease and mortality. I hope you have understood the clinical presentation of COVID-19 virus disease. Be safe, everybody. Let safety lead the way. Thank you. Thank you for watching my first video, and if you found this helpful, hit the like button and subscribe. Thank you.